time to tune in and tune up once again. We're going to take things one step at a time. And to help us take some very important steps, it's Dr. Rohan Newman. Dr. Newman, welcome to Tune In and Tune Up.
Thank you for having me, Kimberly.
So we're going to tune up a couple things. We're talking about feet.
Right.
You are a podiatrist. That's the correct term?
I think I am.
Good. So what made you choose podiatry?
I can give you a sort of a longish version or a short version. Which one would you prefer?
We're going to take the short version too.
Because it's a second career for me. I was looking for something to get into.
Okay.
I was looking at sports medicine. And I came back to the Caribbean. And where my parents live, there's quite a few people there that I'd known from before. And they lost their legs. And I asked my mother what was wrong. And she said diabetes. And I remember when I was searching for something on sports medicine, podiatry came up. And so I decided that I would actually do that to help the people. If I could just give them some advice. Because I was in the UK at the time. I'd just come down on the summer holidays and try to help out in whatever way I can. So that's why I ended up in podiatry.
Now, you spoke about diabetes, and we are on the topic of podiatry. 9 times out of 10, when I think about going to the podiatrist, I think about my feet, maybe as far as my ankles. But there's an important role for podiatry to play, and you can guide me on this. Does it go beyond the ankles then, since you mentioned diabetes?
It does go beyond that, actually, because the problem is when I see somebody in the clinic, and they come to us, the first thing that I would generally tend to ask them is, how are they doing? What's their diet like? Or their blood sugar well control? If it's not, we know straight away, then we start having problems with the foot. And even if I just look at the foot, I can see whether it has dryness to it, whether it's devitalized. You can straight away tell something like autonomic neuropathy might be happening. And that is basically the ability to sweat. So when you get hot, you sweat naturally without thinking about it.
Yes.
So if I look at somebody's feet and it's always dry, then I start to think in my head, are they sort of like becoming neuropathic? So those things are generally an indication. So it's not just necessarily the foot. There are other things that are going on systemically, other places in the body that can influence that as well.
So just by the preliminary examination of the feet, like these here, just looking at my feet.
Your feet are quite nice, though.
And there's no dress up, I will admit. The nail polish, I purposely left it like that.
Did you not? I don't believe you. They're quite nice.
Thank you. So in a case like this, especially when we talk about feet and looking at looking for moisture or looking for feet that are dry, what would be the opposite of what you consider to be nice or standard?
The opposite of that. You can straight away see the dryness in between the toes, even around the nails. Okay. On the plantar aspect, meaning the bottom of the foot towards the arch, they tend to be quite dry.
Okay.
And you can see that, you can see it flaking off as well. So that's a dead giveaway. And the first thing I would draw for then is what we call a monofilament in that case, just to see if they've got neuropathy. And I would probably just check to see if they've got that. If they haven't, or you could just put some kind of pad there just to check the sweat, what they call a neuropad. And depending on the color that it gives you, you can tell straight away if they've developed that sort of autonomic neuropathy. It's not so commonly done in the Caribbean, but certainly in the UK and other places, that is something that they do.
So, Doc, if we are talking about neuropathy, are early signs of this an indication that you could be diabetic, or is it something that we can reverse?
If it's, you mean the neuropathy or the diabetes?
Well, both.
Well, let's take the diabetes first. I think type 1 diabetes you probably can't reverse because that's something you were born with.
Yes.
With type 2, based on the current evidence that's out there, there is some research to suggest that you can actually reverse that. They think that the visceral fat is what's causing it. So it distorts the cells that actually help the body to use the sugar. So if you get rid of that visceral fat, you can slowly reverse your diabetes. With the neuropathy, however, there's only one research that I've read thus far that proclaimed that you could actually reverse it, and that was based in what they call a natural diet, but it wasn't powerful enough. I think they had only about 30, if I'm not mistaken, people in that study. And when they finished, it was about 18 or 20. So you cannot use that to make sweeping changes anyway. So based on the current evidence, the word is you cannot remove or sort of like reverse peripheral neuropathy, something that you probably have to live with for the rest of your life.
What does it feel like? Because peripheral neuropathy is those are two big words. You tell a patient that they have peripheral neuropathy and they're like, am I going to live? What are the problems that they will encounter?
It can become a serious issue, but generally it isn't. I think the problem that they have, if you get tingling, numbness, sort of like shooting pain, some people say electric, stabbing pain, and it's mostly in the evening for whatever reason. It's when it comes on.
Really?
Yeah. So if somebody comes to me and they say they're getting this tingling pain, this numbness pain in their feet in the evening, then I suddenly start to think neuropathy. So that's what it is. They just can't feel. They don't know that they have it sometimes unless you tell them. The main issue with that is if you are diabetic and you have neuropathy and you start to walk around barefooted and you get a cut or something pricks you or get stopped by a nail or something, then you can have some serious issues because you won't know that you've got that scratch probably until it's too late. And when we think of the Caribbean in particular, that's why people mostly are losing their limbs because of infection. They don't know they've got a cut or a bruise, and by the time they get to somebody who can help them, it's already too late.
Wow. Wow.
But it needs to be said, though,
yes,
you can live with that comfortably if you actually monitor and take care of your feet, if you know that you have neuropathy.
Now, taking care of our feet sometimes is something that we take for granted. Men and women especially do it, and I have to admit, we women do it because we're slaves to fashion. I'll get back to that in a moment.
You're better at it, though. We need to get the men on that as well.
But what about toenails and ingrown toenails, fungus? Let's talk about that. How does it start, and how can we, A, treat it, and B, more importantly, avoid it altogether?
Which one do you want me to take first, fungal nails or ingrown toenails?
Let's start with the ingrown.
Okay. So ingrown toenails, that we mostly see with the adolescents population, really. Mainly boys as well. Because they don't cut their nails properly and they pick at it, and then the nail edge goes into the skin. So that's generally what happens at that age. You do have what you call genetic anomalies where you can actually have sort of like a curved nail that grows into the skin. So there is that. You can have footwear that's too tight that can cause it as well. In the adult population, it's a similar feature, not necessarily how they cut their nail, or because of genetics and the type of footwear that they use, or trauma. So that punches the skin, and then once the nail gets damaged, it doesn't normally go back to how it was before, so it stays permanent. So you can actually cut it out, but it will grow back, and then the ingrown nail starts again. So that's how generally it occurs. In terms of treating that, it's a little bit easier to deal with ingrown toenails because you can cut it out with or without local anesthetic and see if it grows back. If it does, and the patients are up for it, you can do a minor procedure just to take out that corner of the nail. And within a couple of days, it starts to feel a lot better. Within a couple of weeks, it's healed. And no one can tell that you actually did the surgery, and that should permanently solve the problem. So for ingrown toenails, it's pretty straightforward in that regard. With the fungal infection now, though, that's the devil. I think if you can find a permanent cure for that, you'll be the richest person in the entire world. It's the devil to get rid of. It really is. So you've got a couple of moles all over the place. You got trichophyton, rubrin, and mentogrophitis. They are all over the world, in every country. Walking barefoot, you cannot avoid them. Now, fungal nail, believe it or not, occurs simply because the nail is damaged and the fungus gets underneath it.
Okay.
Fungus cannot attack a healthy nail at all. So when somebody comes to me and I see that discoloration, I'm starting to think there is some trauma, whether it's small or whether it's big. So then that happens. So there are a couple of things you can do quite quickly. You make sure you don't walk barefoot. Make sure that you treat all your footwear, and make sure that all your socks, stockings, or hosieries are washed in temperatures of 60 degrees or above. That's a given. That's what you have to do because it's so difficult to get rid of. That's just the basic bit. Then you can start with, if it's very mild, you can start with topical treatment. At home, I suppose you could try Vicks. Now people hear me say Vicks and go, "You're a quack. What sort of footman are you? You can't be talking about something like Vicks." Well, actually, in the literature, there is some evidence to suggest that for mild fungal infection, Vicks
Fantastic.
does actually work. I think in about 30% of cases, people get resolution from it. And I've had patients who come to me and say, "This is what I've been using, and it's been fantastic."
And we keep Vicks vapor rub at home all the
Vapor,
time.
yep. So it's very safe. Before you go to bed, just rub some on and see how you get on with that. So that you can try. But in terms of proper scientific treatment, I think the only thing that they've found that worked really, really well, and it's a systemic treatment, and it's Lamisil or terbinafine. That's the actual name of the pill that they actually use.
Yes, I've seen it.
So that's what you have to take, and sometimes you have to be on it for a long period of time. Now, some doctors don't like to prescribe it because they think it can damage the liver. But I think what had happened a couple of years ago in America, I think some patients were on it, but they were on other medication. And what had happened, they had liver failure. They cannot say for sure if it was the terbinafine that had caused it. So because of that, and they weren't sure, they had said to the health professionals, try not to prescribe that too much if you don't have to. But that seems to actually work quite well, places like North America and in the UK. In the Caribbean, what I'm learning from other health professionals is that it doesn't work so much because maybe the sort of fungus that they have here is slightly different. So how we go about that then at Comfeet where I work is simply basically we take clippings from the nail, send it to the lab to see what fungus is infected with, and then we treat it that way.
Yes, I heard you mention at least 2 or 3 varieties, and I did not even consider, that they had a particular name.
Yeah, there's quite a few.
Wow.
Yeah.
So you mentioned adults. Is this something that we can see present in children?
Yeah, children as well. But it's much more rare, and it's because children nails tend to be, adults tend to get nail damage because of maybe footwear, playing football persistently over a long period of time, some kind of trauma over many years. With young kids, you don't see it so much because their nail is sort of like intact and the fungus cannot get underneath there so easily. So you generally tend not to see young people with fungal infection unless they've got a trauma to the nail.
Okay. Let's talk about being slaves to fashion. I'll start off with the ladies. I accept. We do it.
Are you a slave to fashion?
Not entirely.
No?
But I use the excuse that I have a sedentary job to wear whatever I feel like on my feet. But if I'm going out there for long hours, I'll find a sensible shoe. So what is the right shoe for us to wear? Let's start with being able to, one, find and understand what our sizes are, because nowadays people seem to wear a range of 3 sizes depending on the makers. Years ago, you knew exactly what it was.
Yeah.
And we can work up to what is the most comfortable shoe one should be looking for to purchase, depending on the kind of lifestyle that they live.
I suppose if you're an athlete or you're just a normal population, I think you have different requirements there. But let's start with the normal population. That's probably those are the people who are listening to you the most. So if you'd probably need to know your shoe size first, definitely. So you need to get your foot measured, preferably maybe in the evening when your foot is at its biggest.
That's the best time?
Yes, because a lot of people don't know this either. Because when you wake up, your foot is not as big as when you go to bed.
Well, this is true.
Yes. So you get it measured in the evening. And if you're buying shoes, you should buy it in the evening as well for that
Really?
reason. Yes. So we must start off with that. And I think for
I learned something new.
for the adult population, it might help too if if you got a wide width foot, if you have a higher arch or a lower arch profile. Okay. Those are things that can help you guide what sort of footwear you would want. Mm-hmm. So knowing this then, you sort of look for a shoes that is very supportive and very comfortable at the very, very basic level. A few more tips that you might want to bear in mind is that the shoe, you shouldn't be able to hold the shoes in your hand and wring it or bend it back all over the place. It needs to have a bit of rigidity to it. It shouldn't be that flexible. Because you can imagine, my hands are very strong. Your hands probably are strong as well. Mm-hmm. But if you can bend the shoes and you put that on, imagine what your foot will do with it, because of the weight of the body and the strength that's in there. You have to be a bit careful, because otherwise you'll be sending your foot all over the place. And at about a couple of weeks, you start to feel pain and you don't know where that came from. So you need shoes that are supportive and very comfortable. And I always say, always get shoes with a fastener if you can. That is lace, Velcro, buckle, or a zip. And also get one that follows the contour of the foot, because the evidence does suggest that a rounder type shoes takes pressure off sort of like the big toe area, and believe it or not, a pointy shoes take pressure off the other toes. So what they now suggest, if you get a shoes that has a slant outside feature with a sort of like rounder towards the big toe, you get better utility out of that, less pressure.
Okay, so when we went through the era, because that era is gradually going away, when we went through the era of the super pointy tip heel, that was putting undue pressure. And
you'll find that maybe not so much on the smaller toes, but maybe the big toes, you start to see people with bunions.
Yes.
And start to develop stuff like that.
Yes.
And maybe corns on the bottom of their feet.
Yeah.
So I am not saying that you shouldn't wear pointy type shoes, or you shouldn't wear this shoes or that shoes, but you have to be reasonable. It should be wide enough, deep enough, and if you can, it should have a fastener. The other thing, because I know a lot of women are probably thinking about it, heels. It's not that you cannot wear heels. You can wear them, but maybe when you're going to the venue, do not wear it then. And when you get to the venue and you have it on, if you can take it off as well. If you need to wear it at work, if you're seeing clients and you need to look professional, you probably, when you're sat at your desk, just take them off. But when you're going to see your clients, then you have them on. You need to be a bit judicious in how you actually wear the heels. But ideally though, we would prefer you to wear, females and male, because some males wear high heels as well, maybe 2.5 inches, 2 inches, no more than that. Ideally.
I tend to go along the lines of at minimum a 4-inch, given my stature.
At minimum.
Yes. However, I do it sensibly. So yes, I sit for long hours, so I wear a pretty looking shoe. The heel is not reasonable to walk about in for long hours. But if I'm going out into the field, I often choose then something that is like the 2.5 or a flat with some level of elevation, not too flat. Can too flat also be a problem?
It can, because what will happen then, it won't affect the forefoot so much. So the heels, the reason we're against heels is because it puts a lot of pressure on the forefoot. So like corns, calluses, and nail problem as well, ingrown that we spoke about earlier. Yes,
okay,
it can do that, because people will and quite often people can't associate the two necessarily with the flats. What the flat does, especially if you've been wearing heels for a long period of time, it stretches the calf.
Okay.
And not only that, because it's connected to the plantar aspects, you got a big fat tissue called the plantar fascia. It stretches that as well. And then suddenly you find yourself start to develop arch pain or heel pain simply because of that. So you have to be a little bit careful. That's why we say a moderate heel is sometimes good for you.
Is that complication that you speak of, is that described as plantar fasciitis?
Plantar fasciitis. Okay. So that's what we call medial heel pain. And that's basically just trauma to the plantar fascia. And that it's multifactorial in nature. It's not just one thing that causes it, and especially females, because there's a higher incidence of female getting that than male between the age of, say, 40 to about 60, that little group there.
Okay.
And that may be attributed to menopause as well, because of the estrogen is lowered, and when that happens to the female body, the muscles are not as strong, the ligaments are not as strong, and the tendons are not as strong. So the biomechanics of the foot is not so aligned as it was before. And so often they'll come to the doctor and they get in pain, and the doctor says, nothing is wrong with you really, but is the menopause symptoms that are causing all of these.
All of these different
because
things.
They didn't traumatize their foot, they didn't change their footwear, but it can happen. So those are things to bear in mind as well.
Wow.
Yeah.
Tell us about our men. How should our gents choose a shoe?
I think it's pretty much similar. Men should choose shoes that are supportive and comfortable as well. They should make sure that the toe box, the front of the shoes, is wide enough and deep enough for their toes, and they should use something with a fastener as well, and generally a mild heel. It shouldn't be too tall, nor should it be too short. And the same thing goes for them when it comes on to court shoes or dress shoes, if you like. It shouldn't be too pointy either. So your shoes should basically be comfortable for the toes to fit in.
Dr. Newman, the average Bajan would tell you that there's some of us, as long as we're not in the work environment, especially if we come from an office environment, we would be a lot more comfortable just pushing with 2 foot and some go forwards.
I don't know what those are. You have to explain that.
Slippers. No back, no nothing, no buckle, just the thing between the toes, and come let me go. And we see a lot of men do that, and a lot of women do it fashionably, but a lot of women do it too.
Yes.
Is this something that we need to guard against?
Well, so because I'm coming from the UK, I don't see people wearing slippers so much because of the winter and the climatical conditions, only the summer. So when I got here, I started noticing people with what we call a fissure, a lot of crack heels. Generally, when we get that in the UK, it's because people are wearing a lot of slippers, or they're getting a lot of so what we call plantar forefoot calluses, corns and stuff like that, dryness of the skin, cracking of the skin. And a lot of it is attributable to the slippers that they're wearing, but it's not something they're not necessarily making the link. So I think if you need to be on your feet for long periods of time, it's not the best footwear to wear. You should wear something more appropriate. If you're in the house and you're going somewhere, maybe you're on the beach, maybe you're on the veranda at a house party or by the poolside, I suppose it's fine because you're not going to spend loads and loads of time in it. But it shouldn't be your daily footwear because then you're asking for trouble there.
All right. Now, for those of us who are in jobs that require us to stand for long hours, any advice in terms of footwear or any additional aids that you would recommend to help the process be a lot more comfortable?
I would prioritize support and comfort. So again, it goes back to make sure you know what foot type you have and make sure you wear the appropriate shoes to fit that. So you might need something with a little bit of a raised arch just to give your arch a little bit of support there as well. And try not to get shoes that are too thin or too flimsy, because oftentimes people think that because the shoe is light and because it's soft, it will protect your foot better. To some extent it will for a short period of time, but spending time in shoes like those will start to put the foot out of alignment and you will start to get pain. So you need shoes with a thick enough sole and a little bit of rigidity. You need to make sure that it has a fastener. And if you like the shoes that you've got, if you like it, you could also put insoles in there. There's nothing wrong with putting a gel insole in your shoes just to cushion the bottom of your foot, or get a gel heel cup to cushion the heel there. So you can do stuff like that as well to help out with your footwear.
Do compression socks and stockings also aid in protection of the feet, or is that more so circulatory? That's
more for circulation. I think if you wanted to help protect your feet as well, you could do stretches, certain types of stretches for your feet. You could do strengthening of the muscles in the foot. So a good one you could do, you could just use your toes, stand on a towel, sit, put your foot on a towel, and use your toes to draw the other end of the towel to you. Do that a couple of times. That strengthens the intrinsic muscles in the foot, and it does help prevent stuff like plantar fasciitis and foot-related pain. So those are things that you can do. There's nothing wrong with getting a foot massage. People get a sense of well-being after they've done it, but not only that, it causes blood flow and it promotes healing by flushing the foot of toxins and help the body get rid of waste as well. So you could do that. There's nothing wrong with soaking your foot as well to help out in the evening with some Epsom salt. The old remedy, old people like to, well, let me not say old people, mature people like to talk about stuff like that.
So that trip to the pedicurist, and this is not just about prettying up the nails, but getting the foot soak and taking off the dead skin and the massaging of the feet and all of those things, adding the other minerals to it. That's good for all of us, yeah?
I would say so, but I need to put a clause there. Because we've had a couple of diabetic patients who have been to nail salons, and sometimes they're a little bit too aggressive, too overzealous, and what they do, they tend to cause trauma, and then we got infection, not just fungal infection, because you can get that too, and you got skin infection there, and it can cause serious trauma down the line. So I would say for those who have health-related issues, just to be a bit careful with that. And for the normal population, I think it should be fine, so long as the people who are doing it are certified and they're maintaining strict clinical hygiene. It shouldn't be a problem.
I think that's good advice for all of us out there. In our last couple of minutes, is the podiatrist someone that I should put on my list to see at least once or twice a year? We always have to go get our general checkup. We're often recommended to get, for our men, our prostate check, for our women, our mammograms, see our gynecologist. Should I see my podiatrist once or twice a year?
I think you should at least once. And my reason for saying that is very often when I'm in the clinic, patients come in, especially those who are mature, they put that out there, and they say, I had no idea feet were so important. But if you think about it, if you don't have your feet to walk on or your foot to walk on, what are you going to do? You're going to be sat at home and your quality of life deteriorates significantly. So that's one of the appendages of the body. Your foot, you should be checking it. So I would say at least once per year you should go in. You shouldn't wait until you have major concerns for you to do that. Just let them give it a one-over, give you a check and give you some advice on what you can do. You'll be very surprised what they find out and what they can prevent down the line. So yes, you should see a podiatrist.
So we're going to take this one step at a time. In fact, if you haven't taken that first step, make it your first one now. Dr. Rohan Newman of Comfeet Care, it's so good to have you here with us on Tune In and Tune Up. I hope that you're ready to tune up those feet and start stepping to the podiatrist. And next time, we'll see exactly where our feet takes us.
Thank you very much.